Good evening and welcome to the first in our series of professorial lectures for the School of Nursing and Midwifery in this academic year. My name is Kenda Crozier and I'm the head of school, and I am just going to do a bit of housekeeping first of all. For those of you not familiar with the building, we're not expecting any fire drills or alarms. In the unlikely event of an alarm being activated, make your way to an assembly point. Please do not re-enter the building until instructed to do so by a person of authority. I think the exits are behind you. And there's one over there. Okay, folks. So that's our health and safety officer. Just thank you, Kevin. So the professorial lecture is a time-honoured tradition in academia, and it's a way of welcoming new professors into the academy. So I'm very pleased to introduce our Chief Nursing Officer for Northern Ireland, Professor Maria McIlgorm. Maria was appointed to the post of Chief Nursing Officer for the Department of Health in March 2022. So you've been there 2.5 years now. Prior to joining the department, Maria was a professional advisor within the Scottish Government, and she joined the nursing register in 1988 before becoming a midwife in 1990. Since then, she has worked across a range of acute and community settings within health and social care in England and Scotland, and has gained extensive leadership, management and strategy experience. Maria graduated from the University of the West of England in 1994 with an undergraduate degree in midwifery. In 2011, she successfully completed a leadership program with the Harvard Business School, gaining a postgraduate diploma in leadership practice from Edinburgh Napier University. And most recently, Maria completed a coaching and leadership for improvement program through NHS Scotland. As Chief Nursing Officer, Maria leads the nursing, midwifery and allied health professionals' contribution to the development and implementation of health and social care policy in Northern Ireland. That's a very big portfolio. Her team of professional nurses, midwives and AHPs provide advice on adult and children's acute services, mental health, elderly care, learning and physical disabilities, public health, community health, primary care, midwifery, and international issues relating to the professions. They also advise on the regulation of professions, education policy, workforce planning and development. So without further ado, I would like to present to you Professor McIlgorm.
So good evening, everyone, and thank you for inviting me to speak this evening at this year 24-25 professorial lectures. First, can I say thank you to Professor Donna Fitzsimmons, previous head of school. And when she first mentioned this to me, I actually nearly fell over. It's not something I ever would have seen for myself. But also to welcome Kendra as our new head of school, and I really look forward to working with you, Kendra. So it's a great privilege and honour for being made an honorary professor at such a prestigious university as is Queen's University Belfast, which is prestigious not only in the UK but worldwide. I must say, in preparation for this, and my imposter syndrome and that chimp monkey that I don't know if you've read the book was absolutely going wild and jumping around in me. So I'm really, really, truly honoured. So thank you so much for that. So I'm going to start, and I'm going to hope that I get this right. So I'm going to start a little bit about what matters to me. For all of you who are nurses and midwives in the room, this is something that we talk about a lot for our patients and the people that we care for, our mums and babies. And first, let me share with you that first and foremost, the most important thing to me are friends and family. And I've got my sister here in the audience today. She's very close to me. We're like twins, only 2 years apart. Double trouble. what my parents used to call us. They keep you through thick and thin, good times and bad, support your resilience. And there's been many a times they've dusted me down, picked me up, and allowed me to carry on. My children, James and Imogen, are extremely important to me. I'm truly proud to be their mum, even though they may have thought I was a bit of a monster at times. One thing's for sure, I think kids keep you really grounded, don't they, in life, and keep you in reality. My parents, who are in the picture there, looking lovingly at each other, they were my greatest role models. I've worked with great leaders throughout my career, but I can honestly say that they were the people who most inspired me. My dad was a headmaster of a primary school, and my mum was a nurse and a midwife as well. She ended her career as a neonatal sister and our house, and taught us how to clean so well. Everything was absolutely spick and span. I love cleaning. And I have this issue about cleaning as a nurse, I have to say. I walk around the wards looking at cleanliness. So just to be aware of that if you ever see me out. Their love and kindness and belief in me and their spirituality made me what I am today. Even though during the course of my life, I made their life completely difficult at times, and certainly they would not have seen me as a professor today, but I know they'd be extremely proud of me. My work has always been really important to me, and that's a picture of me in my CNO uniform that Mary Frances insisted that I get, and I actually love wearing. I'm really proud of wearing it. I've always liked wearing a uniform. I've had to learn over the years as a working mum that what's really important is about your resilience and your personal resilience as a leadership. And I have had some really difficult times, as well as some really fantastic times as a leader. So through some really significant events, both personally and professionally to me, I've really been taught how important that is and how important it is to give yourself time. So I love walking. I've done several walking marathons. I love cooking, and Paula knows that because she and I spend hours in the kitchen together, usually with a glass of wine. I spend hours in the gardening. I love DIY, and I've just built that path that's in the picture there as well. So I'm preparing for my retirement, and I absolutely love spending time with friends and family. So that's a bit about me. So my career journey to date. So I've had a very varied career with many opportunities, which I've grasped through nursing and midwifery. So not really knowing what I wanted to do when I left school, I took up a first position as a nursing auxiliary in St. James's Hospital in Dublin. And Paul and I started there together. We got the train and then the bus, and the smell of hops would have knocked you out, but it was just next to Guinness Brewery, just in case you don't know where it is. Fabulous experience, and that's where the seeds of nursing and midwifery were planted. I started my career in 1985 as a student nurse at Our Lady of Lourdes Hospital in Drogheda. That was a medical missionary hospital, and they certainly were training you for the mission. So I was very, very astute about saving money, and still am today. I hate waste. And I worked and worked there post-qualifying before deciding to move to London to be a midwife. I was very lucky during my training and post-registration training, the opportunities that I got to work in many clinical areas, which grounded me in my early career. And I think that's really important for us going forward, because actually people tend to choose specialties, but actually having that wide experience is really, really important. Well, I felt it was anyway. I qualified as a midwife in 1991, and during my study, I also worked as a nurse in Hammersmith Hospital and Ealing Hospital, and there's some pictures of the buildings that I worked in to pay for holidays, which were really important. Post-qualifying as a midwife, I worked at Queen Charlotte's Hospital in London, both in the labour wards and the postnatal and antenatal wards. And in 1993, as Kendra said, I moved to Bristol for the year to do a BSc Honours in Midwifery at the University of the West of England. That was really inspirational for me. And I think it's fantastic today that nurses and midwives qualify with a degree. Certainly in my day we didn't, but that actually stretched me so much when I did my first degree. So moving to London, moving to Bristol and living on a student loan was a challenge after you've been working. So I got the opportunity to actually do nursing and midwifery shifts in Bristol, which was also a new experience and gave me other opportunities, which I really valued. When I returned to London in 1994, I worked again at Queen Charlotte's before moving to the West Middlesex Hospital Trust, and I was based in Ashford in Middlesex. And though, if you know, West Middlesex Trust has got 3 big hospitals. After a year and a half there, I decided to return to Queen Charlotte's. I always had a real passion for Queen Charlotte's, and I joined the one-to-one midwifery scheme, which was the first continuity of midwifery scheme that was ever there, under the leadership of Professor Leslie Page, who many of you may know. So between 1986 and 2001, this is a whistle-top tour of my life. I got married, had 2 children. I took on different roles. I actually stepped down from being more senior roles to what was then deputy charge nurse. We had all the grades, the F grades, the E grades, the D grades in those days. I also worked as a practice educator, deputy charge nurse. I managed complaints. I took a role in clinical governance, and I spent time working in NHS Direct, which was a really interesting experience as well. Before I moved to Scotland, which was for personal issues. My husband then was from Scotland. When I first moved to Scotland, it was really interesting because there weren't any jobs. So I worked in Bupa, which is an independent nursing home, or independent home hospital. I worked in general medical and surgical wards. And at that time, cosmetic surgery was becoming more commonly sought, which really interested me. I was also put in those wards because they said that people who inflicted pain, as being a midwife, that inflicted pain on yourself, which I thought was not very nice. I was used to actually looking after people. So, but it was really interesting. It was a time of quite a lot of change in terms of cosmetic surgery. So that was a really good experience to me. In 2002, I eventually got a team leader, community midwifery team leader post in Edinburgh. And during that time, I was actually approached to apply for the recently vacated principal midwife post at Edinburgh Royal Infirmary, or Simpsons, as some people know it. Not long in post, I was asked to widen my remit to include gynecology, neonates, and fertility services. This is purely professional leadership role. And in 2005, then, there was a significant change management process. And Michael knows all of this because he worked in NHS Lothian with me at the same time. And they merged all the trusts and became health boards. And at that time, 2 of the big maternity units moved together. That was St. John's in Livingston and the Royal Infirmary, Simpsons. And that was a massive portfolio then to actually manage, because I had community teams in East, Mid and West Lothian. There was Edinburgh City. There was 11,000 births per year. I also had tertiary neonatal services, fetal medicine, abortion services, early pregnancy, gynecology and infertility services. And that role changed from being a purely professional role to an operational role with strategic and professional responsibility. It reported directly to the executive nurse director of the board, and I was also part of the senior leadership team within women's and children's services. In 2011, as part of the restructuring and following a significant event, I was asked to extend my role yet again to include neurosciences and neurology, which was really different for me. I haven't never worked in neurosciences and neurology, but a fabulous experience and great opportunities to do things. So in 2014, my life got a bit of a challenge, and I was diagnosed with cancer. So when I returned to work, and that was a massive life-changing experience for me, and thank you to family and friends and everybody else who actually got me through that period. I had 2 teenagers at the time, and it was really, really hard. So after all of that, and I got through it and got through the chemotherapy, I thought, you know what, I've been in maternity services and women's health for a very long period of time. I think I'd like a change. So I thought it would be a good idea to actually move to the Edinburgh Health and Social Care Partnership, which was a nursing role, had chief nursing role from vacant. And that was at a time when health and social care in Scotland was just merging together, and the integrated joint boards were being established, and I became the chief nurse of the joint boards. And within that job, I actually changed and extended again and got to experience more services. So within that role, I had learning disability services, community mental health services, sexual health services, 4 community hospitals, which is around 240 beds, the brain injury unit and the rehabilitation unit. Again, new experience for me, but that experience, you bring experience with you as you go along within your leadership roles. So I've had fantastic opportunities during this career path that I've had, and I'm in probably the end stage, which I'll talk about in a minute. But I've had really opportunities to do the things differently, to introduce change. I was involved in building the first birth centre, in both commissioning it and developing it and delivering it, which I was so proud of, for NHS Lothian. Lots of really good experiences, developed the first electronic patient record for maternity services, which was just new, gave us really good data at the time. I know it's got nothing on a compass that we'll have in Northern Ireland going forward, but at that time, there were really good opportunities. So moving on from social care in NHS Lothian, in 2018, there was another reorganisation. I seem to go through my career of different reorganisations. So if I come to work for you, just be careful, because it could be a reorganisation. The same happened when I went to the department, actually. So in 2018, after another reorganisation, I moved to work in the Scottish Government as a professional advisor. And I took on the portfolio for transforming nursing and midwifery roles, community nursing, district nursing, neighbourhood care, care home nursing, which again was very different for me and not where I had started my career. So I also was there during the pandemic, which was a really, really difficult time. And we've heard our CMO giving evidence today. And we can't not forget that, because that was a hugely challenging time for all of us who work in health and social care, irrespective of where we worked. So also during that time, I led work on the quality assurance framework for integrated care, because in the integrated health and social care partnerships, we brought health boards and local authorities together. And that was a challenging time, not only for the people who worked in the health service, but also people who worked in the local authorities, because there were two very different cultures that we were actually bringing together. And Michael knows the challenges that we had there, but a really good leadership opportunity. So in September 2022, I was over actually visiting my mum here in Northern Ireland, and it came on the Nolan show that Charlotte had actually resigned, or was planning on resigning from her job. And my mother said to me, "Maria, you should apply for that job and come back here and look after me." And then she prayed. So she fell in October, and I came over to see her, and I was on my way back, as Paula knows, because we were there together, and I had a nap because I was thinking about coming back to Ireland to work. And popping up in the app was the job advert for the CNO for Northern Ireland. So I applied, and I got the job, and I'm here today. And thank you again for my professorial. So whilst I did not go through the normal route, I suppose, for people that go into chief nursing officer roles, I think as you move through your career, you realise that all experiences that you have just mount up, and everything that you learn is transferable. It's like you fill your career hold all, and you can just keep pulling bits out of it. And I think that's really, really important. And I think one of the things that I was asked recently was, what would you say to somebody coming through their career now? And I would say, just grab every opportunity that you can, because every opportunity leads to something else. So I am absolutely, truly honoured and privileged to be the CNO of Northern Ireland. And like the professorialship, I never thought my career would end up where it is. So I'm going to give you some slides about sort of the job. So Northern Ireland Executive, some of you will know this, some of you may not. But the department, the executive is made up of the Department of Justice, Department of Health, the Department of Finance, Department of Education, Agriculture, Environment, Department of Economy, Department of Infrastructure, and Department of Communities. And many of you are in the room saying, why is Maria showing us all of this? And the reason I'm showing it to you is because health doesn't sit on its own. it sits as part of the other policy and areas in the other departments. So, for example, prison health is justice. We contribute to prison health. And in finance, they're the people with the money. They're the people who fund our services. Really important to be friends with them. So the Department of Education, many of you will know, Michelle is here today as our Chief AHP Officer, leads on work to do with special education needs. So we have really close links with education, but also our health visitors have close links. Our school nurses have links with education. So it's really important that we are actually linking across as professionals that work in the department. Department of Agriculture, Environment and Rural Sciences, believe it or not, we actually link across with them, particularly around antibiotics, the use of antibiotics, and everything to do with that. So actually we do link really closely with that, but also around the whole sustainability agenda, which is becoming more and more important. Department of Economy, similarly, they've got the money, the F and the E in there are really important. And then we have the Department of Infrastructure. That is equally important because actually one of the challenges we have in Northern Ireland is our transport network, where we actually have our hospitals. So we need to actually keep in with them. It's a really, really important part of what we do. And then the Department of Communities, and that's housing. That's our communities that people live in. That is also really important. Housing is one of the biggest and most important things for health and the determinants of health. So the reason I'm showing you to that is that I am the Chief Nursing Officer within the executive as well as in the Department of Health. So the department structures. So we have 8 different directorates within our department. We've got a new health minister, Mike Nesbitt, which is going to bring with it a renewed sense of hope and vision for our health and social care services. And I think it's a real opportunity to work collaboratively and to engage in meaningful dialogue and to share our aspirations and work together, forging the path to prioritise health and well-being for our communities. And certainly the Minister has got a really big focus on health inequalities and reducing waiting times. And as I've said before, the determinants of health are much, much wider than hospital. Only 20% of care and health is within the hospital. So within our structure, I've said there's 8 directorates. They cover all of health and social care. We are the largest department in the civil service and with a vast portfolio, as you can see, across these different areas. So really influencing important role that we play. So this is the role of the CNO. And that's within the department structure. So I have a group within the department that covers all of nursing, midwifery and AHPs. And within that role, I represent the voices of nurses and midwives across a range of policy areas covered by the department and wider, influencing and assisting the decision-making processes, developing and implementing major programmes of change and policies to improve health outcomes for people of Northern Ireland. The other part of my role is to provide professional advice to the Minister of Health and Permanent Secretary and policy officials within the department on all aspects of nursing and midwifery. And I work very closely with Michelle, our Chief AHP Officer. I'm responsible for professional leadership, performance and development of nursing and midwifery professions in Northern Ireland. And I work very closely with the UK, 4 UK CNOs, the CNO in Ireland and the World Health Organization. So within Northern Ireland, we've got 28,725 nurses who are currently, and midwives who are currently registered with the Nursing Midwifery Council. And I am really pleased to say we have seen a sustained growth over the past few years. And I also want to point out that we are the only country who has maintained its learning disability nurses. And that's really, really important because that's not happening in the other countries. And given all that has happened in Northern Ireland with McIlgorm, etc., I think that's a real credit to the universities. As nurses and midwives, we play a pivotal role in setting the direction and being part of the change we and our people want to see. Our expertise in both clinical care and patient advocacy puts us in a key position to influence change. Our abilities as nurses and midwives to bring strong relationships with people we care for and the teams we work with, whatever the role we do, be that in hospital, community, education, regulation, higher institutes of education, research, or government, creates trust and confidence, which are essential to address health inequalities and to achieve the best outcomes for people across the lifespan. Believe it or not, we are the most trusted profession, and I think that's something that we should be really, really proud of. Our collaborative effort as nurses and midwives are crucial in addressing population health needs and achieving optimal health outcomes. By combining our unique expertise, we can lead the changes that need to happen for us to sustain and grow our services to meet current and future demands for healthcare. As health and social care leaders, we play a crucial role in advocating the necessary policy, resources, training, and infrastructure to enable transformation and ensure nurses and midwives have what they need to succeed. So I'm just going to go and move on to the Northern Ireland context. So within Northern Ireland, which was really interesting when I came to Northern Ireland, because a population of 1.9 million, if I compared that to Greater Glasgow and Clyde or Greater Manchester, it's probably equal sized populations. I think the difference in Northern Ireland is that we're very geographically widespread, and our infrastructure, which I spoke about earlier, is a challenge when we're actually getting people to and from hospitals. So that's really important in terms of healthcare. So whilst we need, and we've got a budget in Northern Ireland of about 7.3 billion, and whilst we know we need further investment in health and social care services, it is important that we are utilising our resources in the most efficient and effective way, as ensuring safety is at the core of what we do. And I think that's so, so important. Northern Ireland, since devolution, has experienced significant political instability, all of which has had an impact on health and social care. And having never worked in Northern Ireland before I came here to take up this role, I found that real challenge. Actually, the fact that there was such political instability. But what was amazing is that people just continued to work, continue to provide services, and just get on with it. It's just been quite amazing, actually. Like the rest of the UK, Northern Ireland has experienced austerity over the last few years, and we continue to be in an increasingly challenging fiscal climate. To meet the current and future demands of our health and social care services, the direction is clear. We must shift the balance of care. Hospitals should be for acute episodes of care only, and we need to enhance our community and primary care. This has been the policy direction for many years now, actually 2016 in the McIlgorm report. And as nurses and midwives, we are pivotal to enabling that shift, and I truly and genuinely believe that. We have significant health inequalities that persist and are indeed increasing in our society. Many communities face barriers to health access and outcomes, and socioeconomic factors play a crucial role in Northern Ireland. In fact, Northern Ireland has the worst health inequalities in the UK, and the legacy of the Troubles and the recent pandemic has added to that. Our demographic for Northern Ireland has changed significantly, and I'm just going to go on to the next slide because this, I think, is really interesting. So you can see from this slide that actually our older population is going to be the biggest growth, and our younger population is falling in Northern Ireland. So we have to adapt our health and social care services to meet that growing need. So as the demographics have changed significantly over the last 10 years, and as healthcare providers, we have to respond to that change. We've seen advancements in medicine, which is helping people live longer and healthier lives. However, increasingly, our population is getting older, and whilst we have to celebrate this, we've also seen an increase in complexity, comorbidity, frailty, more people living with dementia, rising levels of obesity, rising rates of cancer, and increasing demands for palliative and end-of-life care. Additionally, there are more people experiencing mental health and well-being issues, and this adds another layer of complexity. So as I said, whilst our birth rate is falling, our population projections are going to continue to grow, but it is growing with older people. We've also seen more complexity in maternity care, and whilst the children in our society are going down, there's increasing levels of complexity and increasing poverty among children. So as health professionals, we can and will respond to these changing demands. Our committed teams, our unique integrated health and social care services here in Northern Ireland, and our recent investments in workforce and technologies will help provide enablers, but it will take time and investment. So last year, I will try and hurry on this. Last year, I launched Shaping Our Future, which set out the 5-year vision for nursing and midwifery in Northern Ireland. Our vision is to build strong foundations that will maximise the potential of the nursing and midwifery workforce in a safe, inclusive and healthful culture, whilst recognising and valuing equality and diversity. We will work closely to create the conditions where everyone involved in providing health and social care can confidently provide high quality, evidence-based, person-centred care. We have built the vision on 3 strategic priorities set out in the Nursing and Midwifery Task Group, which remains pertinent today. The adoption of a population health approach, putting public health, prevention and early intervention at the heart of what we do. Stabilising and growing the nursing and midwifery workforce, therefore ensuring safe, effective care now and in the future. And transformation of health and social care through enhancing roles that midwives and nurses play within and across multidisciplinary teams, and working in partnership with our local communities, councils, independent and voluntary sectors. Our vision will be achieved through 4 key initial priorities. So workforce and workload planning, ensuring that we have the right workforce with the right skills, knowledge and behaviours. Ensuring we have improved data and intelligence to inform workforce projections and student numbers. Pre and post registration education and training. It is projected that by 2030, that globally we will have a shortage of around 6 million nurses to meet healthcare needs. It is therefore absolutely essential that we continue to ensure we train the right number of nurses and midwives in Northern Ireland, not just for health and social care in the trusts, but also for the independent sector. Creating opportunities to widen access to careers in nursing and midwifery will also be important, as will the development of new roles within nursing and midwifery. Development of career pathways, and I'm going to talk a little bit about this, but what's really important in this is that we align postgraduate education commissioning, service transformation, innovation, research and leadership development to our pathways. And my last quadrant is quality and professional assurance framework for nursing and midwifery. We are the largest workforce, so it is absolutely essential that we can evidence the unique contribution of nurses and midwives to improving health outcomes for our people. Nurses and midwives can also make a significant contribution to the sustainable agenda, which is affecting not only Northern Ireland, but globally. So I'm going to flick on to the career pathways. So we've been doing quite a bit of work. There's a lot of career pathways that have been developed in the clinical career pathway, which is the pink one in the middle. And we've seen quite a few of those developed in the past, but also over the last year. The other career pathway is an operational career pathway. So when you come out, you might work in the clinical career pathway for a while, but you might decide to go into management, become a team leader, become a clinical nurse manager, and take an operational route. Or you might go along the clinical route and then decide to go into education or clinical academic careers. So the vision is to actually build our postgraduate education commissioning around these careers. So as you start your career as a nurse and a midwife, you can look at how you can actually build your career up. So that's part of our plan and focus, which I wanted to share with you. And this is our governance for our vision as well. So it reports in through the nursing and the Central Nursing and Midwifery Committee, which reports directly to the Minister. We've got our 4 key priority areas. And the importance of doing that is because it's really important that you do work, you finish work, and then actually give people the confidence that you've actually delivered on work. So that's really important that we've set that out in a way that's simple for people to see. So this year, we've had quite a few achievements, and I just want to say a big thank you to all of my team who are here today, and also to our NIPEC colleagues, because we've got a very, very small team in the Department of Health. NIPEC has got a very small team, and we also work very closely with the PHA and our Health and Social Care Trusts. But what we've seen this year is we've just launched the Collective Leadership Framework for nurses and midwives. When I came into post, the Enhanced Clinical Care Framework for care homes has been developed. So we completed that. We've developed the Advanced Practice Framework for nursing midwives. And I've just, because Michael said he's done this to me today, make me speak, because it's just payback for making me to remodel the Advanced Practice programme. So it's payback time. The hospital at home and bed-based care, we've completed that piece of work, and we've just done a really interesting economic modelling around hospital at home. And care in the community is significantly cheaper than care in the hospital. So we need to really, if we really are to take services forward and to be the change, we need to do that. And there's 28,000 of us in Northern Ireland, so I think we can do well in that space. Equity of access for learning disability framework. This is a framework around learning disability nursing, and sort of the plan for that going forward. Really, really important piece of work that trusts and others can actually take and look at that, how we provide learning disability to that population group. How do we provide care? Commissioning review of maternity services. So this is the work that Mary Renfrew has done for us, which we will be launching shortly. And it was on the back of all of that's happening in maternity care services across the UK and wider. But also we've had two significant events here in Northern Ireland. So RQIA did a review of the safety, and I commissioned one specifically looking at midwifery practice, but actually that widening to look at, because you can't just look at midwifery practice without looking at the wider maternity care services. And we've also launched very recently the standards for maternity support workers. So that's really important as well. So there's a lot of work that goes on in a small team, and I'm one of those people that just says, I've got a great idea, and then they all just run away because they know there's more work coming their way. So finally, so what's next? So within this piece, we have the publication and implementation of the revised delivering care policy. So within Northern Ireland, we've had the delivering care policy for a very long period of time, first implemented in 2014, and that's the workforce workload policy for nursing and midwifery. And every trust applies this within their workforce. But what we're doing now is having a once for Northern Ireland, and also looking at the accountability for that. And the accountability for workforce and workforce planning, starting at charge nurse level, working its right way up to the trust boards, into the department, so that we have really good informed data about workforce needs. The other big project which we're about to start is e-rostering. Every single one of the trusts now in Northern Ireland have got a system called Allocate, which allows you to get real-time workforce data. So at this moment in time, the way we can look at our data is based on what's on the HR systems and not what's real time within the systems themselves. So this will allow us to triangulate the data, but also with Encompass coming on board, we'll be able to triangulate that data with the data that's coming out from Encompass in terms of outcomes for people. The other, I can't see this very well, not terrible, implementation and evaluation of all of the frameworks that we've done, produced over last year. We will be doing that about how well they're being implemented, and anything that we need to learn. I've also just recently commissioned a widening access to nursing and midwifery and AHP. So we've got somebody coming in to look at that, about how can we actually widen access for people who may not get opportunities to come in and do careers in health. And we've been doing a significant amount of work with the trusts and the further education colleges to look at how we can actually get that pathway into nursing, midwifery and allied health professions. And leadership. Leadership is a really important thing for me, and investing in leadership is really important. I have been so lucky in my career that I've had significant investment in leadership development. And well, it has helped me throughout my career. You might be all sitting there looking at me saying, well, it's not helped you that much, Maria, but it has. It's been really, really important to me. And I'm really grateful for those opportunities that I got to develop as a leader. And it's really important for me as the Chief Nursing Officer here in Northern Ireland to make that available for all our nurses and midwives at every level. And we are looking at a programme of developing that now. And we've just mapped out all the leadership. There's a lot of leadership education and training out there. But how do we actually map that and make sure it aligns to our career pathways? And then development of a framework for mental health. So I've just recently commissioned NIPEC to take the lead on this piece of work as well. And that will be following the work that we did for learning disability. But mental health is one of the areas which we need to grow the workforce. We've got significantly more people with mental health and well-being issues within our society, particularly high here in Northern Ireland. So for me, but also it's a workforce that we find hard to recruit to and to retain. So it's really important for me that we actually develop that and we have a framework for mental health the same way as we have learning disability. And finally, we will continue to contribute to all of the programmes for care that are happening within the department, and there's many. So there's the elective care programme board, there's the primary care programme board, there's social care, adult and children's programme boards, there's the cancer programme boards. So there are many, and we and the leadership team that I work with, because it's only a small team, so I have all of CINEMAC and representatives from your trust who actually will represent nursing and midwifery at all of these tables, which is really, really important. And Mary Frances told me that I forgot and I left off district nursing and health visiting when we've also PHA and infection prevention control are also reviewing those services for us at the moment. So just to leave you with this slide. So at the conference the other day, Minister said that I was like Pep Guardiola. And one, I didn't know who Pep Guardiola was, so I had to run off and ask, who was Pep Guardiola? And I'll try and understand what he was implying. So I did. And for any of you who support other football teams, I'm really, really sorry in the crowd. But really, really important in how he has built teams and brought success. And I think that's really, really important to us as nurses and midwives because we work in teams. And it's really, really important for patient safety that actually we work well in teams to ensure that there's good outcomes for people. But my hero is Florence Nightingale. I think if we look back to her very start in life, washing hands and fundamentals of care, we can never, ever, ever move away from them. And I am really, really passionate about the fundamentals of care. And when I came over, and I'm convinced it was through my mother's prayers, to spend the last year of her life with her, it was probably one of the best experiences of my life in some ways. And Paul and I were there in her final days and hours. And one of the quotes that I actually saw on Florence Nightingale's, when I was preparing for this, was around the importance of actually, when you wash somebody, and you make them feel really good when they're feeling ill. And that for me, and seeing Mummy, remember Paula, just washing her and those skills and actually putting her back into the bed, and she was comfortable and she was at ease and she was pain-free. And you know what? I just loved being a nurse on the ward again. So I'll leave you with that and any questions.
You told me a couple of weeks ago I've been lucky to talk for a half hour. You've done nearly an hour. So that's not bad, but that means you don't get quite as many questions. But she's very kindly agreed, no question too small, too complicated and challenging. So anybody who wants to open the floor up with some questions, please pop your wee hand up, to use a Northern Ireland expression, and tell me who you are, where you're from, and what your question is. We email all the time, Jonas, don't we? We email all the time.
We know you don't. That's a good question. Well, can I start by just saying that actually I have loved every aspect of my career, but I think the role that I probably loved the most was actually as a continuity of midwife. And the reason probably for that was the level of autonomy that I had. I had 40 women on my caseload, and they only saw me. I did all their antenatal care, and I, was there for the birth of their babies, and I did their postnatal care. And that was just a really special time, building those relationships with people. But the other part of the career that I loved was actually looking after older people. Really, really important part of me. We have a huge family. There's 13 in my mum's family, and lots of old aunties, and so they all came to our house all the time, and we all had to be there and look after them and be part of that. So care of older people, and that's really why I've shown you the slides today, because that is our growing population. We need to grasp on it. We need to care for people, and actually the best place for older people is in the community or at home. So
thanks for your question. Anybody else? Not like this audience to be shy.
Bored them all to
One
death
more
in my life.
question. Oh, we've got Martin at the back there. You never let us down, Martin.
Thank you.
I would take a interest in health and social. Just wonder in relation to leadership, can you see ways in which really active training didn't change in bit of mother apple pie and what you're making with all and
yeah, thanks, Martin. So our Minister Nesbitt's, one of his top priorities is actually health inequalities and how do we address health inequalities. And the reason I put up the slide of the executive is that he is very committed to working across the executive and working with ministers from other executives around the whole health inequality agenda. But I think from a nursing and midwifery perspective, if we look at the role of the midwife at the very start of pregnancy, birth, they're in people's homes and they're seeing where there are inequalities. We've got our community nurses, our school nurses, our family nurse partnership. We're there. And I think that we need to actually talk about being there because we're actually in people's homes. We are addressing health inequalities. Also, I think in terms of lots of the new roles that we've had, Martin, and I had a really good conference just a couple of days ago. And we heard from nurses who are doing new roles in advanced practice, for example, and about how they're improving access. So we had a nurse in primary care around how they're improving access in primary care, how they're improving access around women's health, cardiology. And we need to grow these roles and we need to work with our colleagues to build these roles because actually access to healthcare in Northern Ireland is one of our biggest health inequalities. I hope that answers your question.
Oops, that's what it is. I'm not strong. Getting there.
Absolutely, absolutely. And I think that whole shift to prevention, early intervention is really, really important. We talk about it, and this became, well, it's always been a big part when I was a midwife, but when I worked in the health and social care partnerships, that was all about how do you bring health and social care together? How do you bring local authorities? How do you wrap around people and communities? And we're still not getting it right. But actually, 28,000 nurses and midwives, that's a big amount of voices. We live in communities, we work in communities, we are communities. So we should be able to really deliver the changes that need to happen.
Well, I'm going to bring things to a close. Oh, sorry, Rita, go on.
Rita,
Oh, and all the questions are
ask
coming in now.
a wicked question.
You've saved a wicked one till the end, Rita.
Maria, I'm just going to ask you, and I don't know if you'll be able to tell us or not, might not be for public consumption. Day has been your biggest frustration since you came to work.
Apart from
Mary Frances has answered the question. My family, Paula said, well, in life you've got quite frustrations, don't you? I suppose, coming to Northern Ireland, actually, the biggest challenge I think I've found is the political instability. I really have found that a huge challenge. And I keep saying to people who work, this is the life in Northern Ireland, does this not really bother you? And actually, so yeah, people just get on with it. And I think that's amazing. That is amazing for the resilience of people in Northern Ireland, for staff in Northern Ireland. Lisa, I have found that probably the biggest frustration in government as soon as I went in. So not only do I join jobs and there's always a change management process that happens, but I went into the government and the actual government fell down. So I really have a track record here. So don't let me near your families.
It's a bit of a cunning scene there.
I know.
Okay.
I just like a challenge.
I can see that. I'm going to bring things to a close and invite our Pro-Vice Chancellor, Professor Ian Bruce, to just say a few words and then bring things to a close. But thank you very much.
I'm just going to be very, very brief. First of all, Maria, thank you very much for a really inspiring talk. I think that your description of your career journey and your arc of your career and where you've ended up as CNO here was an incredibly interesting story. But actually, I think that one of the words you used, I think it's my accent. There'll be subtitles. There'll be subtitles if you want. I think one of the words you used, I think, was hope. And I think what I got from you was the way you're thinking about the nursing and midwifery profession in Northern Ireland, the way you want to play and work and lean into health inequalities, thinking about early starts for mothers and children and stuff. I think that gives real hope for the future, and I think that's really, really important. The other thing that struck me was I'm going to give you a quote, because I think one of the other things I got was something I was thinking about today for a completely separate reason. There's a quote from Steve Jobs, and he said this: that you can't connect the dots looking forward, you can only connect them looking backwards. So you have to trust that the dots will somehow connect in your future. And I think that life arc of description, starting with Our Lady of Lourdes, all the way through to the CNO in Northern Ireland, I think it really, really epitomized that story and that quote. So thank you very much. Congratulations on your professorship and for giving us an excellent talk today. We have a couple of little gifts, but please thank her in the usual way.